Hi guys, Scott McConnell here once again for Distance CME with another Tips and Tricks with Scott. So last week we talked about maneuvering the stretcher in the ambulance to get it locked in, and if you're not on the right track, how to lift the first set of wheels up, because of course they don't pivot. And the second set do. So lifting the top set of wheels up by lowering the foot of the stretcher enables you to now move the stretcher from left and right. And I got a couple of emails with, hey, we're not exactly sure what you mean. So yesterday, while at my other job, of course I am in EMS, so we always have another job, I did record a small video in the bay to kind of demonstrate what I was talking about. So let's take a look.
Recording.
All right, so I know last week a bunch of people had some questions about the tip and trick that I gave them with the stretcher, about getting it in correctly. So what I thought I'd do is I'd just kind of show you, if the stretcher is off kilter, not a problem. Come into the truck, lift the back wheels up, and that enables you to now maneuver the stretcher so that you can actually lock it in to the truck without a problem. Thanks. All right, so hopefully that helped you understand that particular tip and trick. The other thing I want to talk about just really quickly here is last night wound up having a cardiac arrest at the nursing home, and of course my relief was already there, but if we jumped in the ambulance, and I just want to add into the tips and tricks. When pit crew style CPR first came out, we were really skeptical. You look at the studies, and some studies say it works, some say it's not so great, whatever. And let me just tell you, last night, teamwork, everything flowed together. 58-year-old female at the nursing facility, PEA, asystolic. During the 7 minutes we were there, no shock advised on the AED from the nursing facility. And within 7 minutes, we got ROSC. We had an IO, we had an EJ, patient was intubated, 3 rounds of epi, and decent blood pressure, decent heart rate by the time we got to the emergency room, with an end-tidal CO2 of 42, I believe it was. And the tip and trick that I want to kind of just add to that is, when you practice as a team, where everybody knows their role, where those natural leaders come out and run a cardiac arrest, it really, truly does make a difference. So, guys, I'm going to say, practice like you work. Try to train as realistically as possible. And that's really one of the best tips I could possibly give you. Sometimes it's hokey to go through the same thing over and over again, but I'll tell you, there is really something for muscle memory. So guys, Scott McConnell for Distance CME, literally the easiest way for you to research your national registry or state certification. Hey, why don't you check us out? distancecme.com. Saves you time, saves you money, and as our tagline says, hey, take the classroom with you. Don't be chained down to a classroom. Learn with us. So guys, once again, Scott from Distance CME saying, hey, thanks for watching, and be safe out there.